Good morning, this is Dr. Douglas Garata, and we owe it to our primary care providers, those who refer us patients, to let you know what we have done in response to Governor Kate Brown's request that we make changes necessary. Our first goal is to create the safest environment possible with the facilities we have for you and your patients who decide to come for care. Our goal is to remain open as long as possible and take care of as many people as we can, with a special emphasis on taking care of patients who are particularly at risk of the complications of COVID-19. The way we're going to accomplish that is we have a small enough group of employees that we will check everyone's temperatures twice a day. We will not have any staff on site with a productive cough or any upper respiratory infection. We wipe down all of our chairs, all of our doors, all of our facilities between each patient. Our waiting room never has more than 6 patients sitting there, and the waiting room is enormous, so there's plenty of space for patients to spread out. When the patients go to the room, we'll wipe down their spaces. We'll wipe down the elevator, we'll wipe down all of the pens. So we'll do what we can. During our appointments, our exam rooms are 16 feet, and there's plenty of space for us to conduct our appointments with greater than 3 feet separation. So we believe that the precautions we're taking will deliver a safe environment for you, your families, and your patients. We believe this will enable us to stay in business as long as possible serving your patients. The second point is that we're going to focus our attention on treating those patients we believe have the greatest impact on suffering from this disease and protecting them from the disease. And in doing so, we're going to focus on allergy patients, and we're going to take a unique twist on that. Allergy patients, especially this time of the year, are touching their face, sneezing, coughing, rubbing their eyes, rubbing their ears. And these patients are going to be particularly vulnerable to spreading the disease. We have Smart Care for Allergy. If you'd like to learn more about that, please text me and I'll send you a video link so you can learn more about that. Basically, we can cure our patients of allergies without ever having them come in for a shot clinic. We do it from home. So the second topic is patients with a relatively weakened immune system. Males who have hypertension, who are over the age of 55, are particularly at risk of suffering consequences of COVID-19. Patients with hypertension, undiagnosed sleep apnea is something on the differential. Rather than doing an in-house sleep study, which would put them at increased risk of developing this virus, we do home sleep tests. We offer an oral appliance so that it's easier for patients' lifestyles. Patients with sleep apnea have a weakened immune system. If your patient snores, has poorly treated hypertension, you suspect sleep apnea, we will see those patients also. Finally, those patients with postnasal drip, chronic postnasal drip, frequent upper respiratory infections because they have poorly treated sinus disease or nasal disease, those patients we will also continue to treat. If they have COVID-19 and they have an upper respiratory infection, those patients have got the worst outcomes. They're more likely to be on a respirator, etc. So we believe that treating patients with sinusitis, postnasal drip, and upper respiratory disease is important. So we believe that the Modern Nose Clinic can continue to safely offer care for your patients. Thank you for your support, and we'll continue to do our best. Text me if you have any questions or problems. Signing off, this is Dr. Douglas Garata, the Medical Director at the Modern Nose Clinic. Oh yeah, we know your nose.